All right, everyone. So we are now going to start part 4 of the Cosmetology book. And part 4 is all about skincare. So this chapter will introduce you to aesthetics. And you can also spell aesthetics with an E or an A. So if you ever see that online, know that there's 2 ways to spell it. So aesthetics is all about the beautification and the science of skincare. It's going to touch upon a lot of the stuff that we've but we learned about before, such as the hair anatomy, hair structure, skin structure, general chemistry. All that stuff play a role because the products we use are all made up of chemicals and we have to know how to apply them and how they work. So we're going to start off with hair removal, which is chapter 22, and then we're going to segue into facials, chapter 23. And then lastly, we're going to study facial makeup, which is one of my favorite chapters because it highlights that there is such an art to makeup. There is no right or wrong answer for makeup. But hair removal and facials, you can do some serious damage, if not get a lawsuit if you don't do it correctly. So I can say with confidence that chapter 22, hair removal, is one of the quickest chapters. You only have 4 objectives. You want to know the 3 methods of permanent hair removal, know the techniques involved in temporary removal, and know some conditions that contraindicate hair removal in the salon, and describe the elements of a consultation. So hair removal is a decently new area in the beauty industry that you can specialize in. You can be called a waxologist, which is a cosmetologist or an esthetician that specializes in only waxing and hair removal. So waxing is an area that is growing constantly in the industry. I will argue that now there is a huge push to go back to the natural way of just letting your body hair grow in, so that's always another side of the argument. Typically beauty trends will go in one way, then they'll shift back to the other in some way, shape, or form. Waxing is something you can get done in the salon. People can also do it at home. And the book calls it a fast-growing service. Personally, I myself am not a fan of waxing. If you are, make sure you do a continuing education. There are so many techniques to learn. One of the things that I love about waxing is sugaring. It's actually my favorite method to do because it's really simple to use when you learn about it. It's very natural. It's great for someone who's sensitive, and the results become permanent over time. So they give you basically, oh my gosh, I don't know how to say this with a straight face. Hoo-ha waxing, or also known as bikini waxing, is the hair removal that evolved in its own art form. This is a new trend that people are doing. The bikini wax, or what they call the bare bikini wax. For men, they call it a manzillion wax, and you're waxing the hoo-ha area. That involves advanced training. We do not do it in the cosmetology sense. You need special chairs for it, you need special training in it, and you'll typically cover it in like an advanced aesthetics class if you do that, if you go on the aesthetic route, or if you take classes at a specialized salon such as European Wax Center. So with the bikini waxing, it's a waxing technique that requires removal of all the hair from the front and back of the bikini area. It's a popular style of waxing. They do not offer it in the book, but they offer it in the advanced aesthetics version of the My Lady. There's an advanced aesthetics and there's regular aesthetics. Get the advanced one, and that covers all the techniques you'll have to learn. So know that both men and women are now getting waxed. Men that get waxed typically participate in sports such as bicycling, swimming, and bodybuilding and soccer. They remove hair from the legs, arms, and entire body. With swimming, you want to be bare-haired because it's easier to swim, so I've heard. And know that, to an extent too, that certain teenagers, if you are overly hairy, they might be self-conscious and want to get waxed. Self-disclosing here, I myself was bullied for having abnormally amount of hair on my legs and arms. My nickname used to be Caveman, and now looking back on it, I'm like, I should have been more confident. So always know that you never know who's coming in your waxing room. Don't be judgmental. Don't, talk smack about them to your clients. It's not appropriate, not professional. So what I would do back in the day is actually tried waxing, and it was the most painful experience ever. I had a cosmetology teacher who I still love and respect, and she's awesome. She's the only one I can let her joke with me like this. She used to call me a waxing emergency because that's how bad my hair is all over my arms and legs. So what I did do once is I tried to be the practice, or what I call crash dummy, for the cos class. They're still learning. I wanted them to wax just one small area of my leg, and that one area was so painful because of the amount of hair. Even with trimming and prepping it, I still bled, and it was really horrible. So know that if your client is super hairy, certain types of waxes may be very uncomfortable, and that's why I prefer sugaring over waxing. Or what I call radical acceptance. I just accept the fact that I'm hairy, I'm proud. Some people want to be hairy and they have no hair, so yeah. So know that you have different types of hair removal services. Know that the disorder hirsutis, also called hypertrichosis, hyper meaning too much, trichosis meaning hair, is the unusual growth pattern of hair on the human parts of the body bearing only down hair, such as the face of women and backs of men. So types of hirsutis, you can have fine hair like lanugo on women on their cheek, and then men are going to have really thick hair on their back, and that's a type of hypertrichosis. Werewolf disease is a type of hirsutism where you have hair covered everywhere on places it shouldn't be, and it's very thick hair, and they're still studying treatments for that. So know that hirsutism is an excessive growth of or cover of hair, especially in women. Clients with an overabundance of hair are the best candidates for hair removal. So also know that client consultation is going to be very important for getting hair removal services. You're going to have the client complete an intake form that's called a health screening form, and it's used in skincare services, and it discloses all medications topical applied to the skin and oral taken by mouth, along with any known skin disorders and allergies that might affect treatment. The reason being is that certain medications you put on topically, such as Retin A, Renova, vitamin A exfoliators, they can cause the skin too thin. So when you go to wax an area, let's say you're waxing someone's eyebrows and they've been using retinol, you can do this, or Retin A, and you'll go like that and you'll look and say, wow, that looks weird. You can actually skin your client if you're not careful. I know that Accutane is another one. Accutane is poison to the blood, and that medication can cause some serious nasty reactions if you are not careful when waxing. So I always tell my class, make sure you look up the drug reactions and look up pictures so you can really get that gory visual, and that's like an, oh my gosh, I don't want this to happen. It only takes you to have that one client to completely scar yourself for life or ruin your reputation. I knew a professional a while ago, and this professional, not only was she doing something so totally illegal, but she kept failing out of beauty school or cosmetology school, and she was working in the salon and just never finished the program. So she's been doing this. She was in her like late 30s at the time. She was working at one salon. It was her friend's salon, which was a huge no-no because it could have gotten the salon sued. She had waxed a 16-year-old girl that came in the salon. She wanted eyebrow waxing. Didn't even do a form. Wax, wax. After the first wax, she goes, oh, this looks really weird. She did the other one. She started bleeding. Her skin was so thin from the Accutane, it came off with the waxing paper, so her skin was attached right to that paper, and she was bleeding, and it was a horrible mess, and she could have been scarred for life for that. That's actually grounds for a lawsuit where the salon could have gotten in a major trouble, whether it be shut down or a potential fine because they had someone who wasn't working with a license, and also because they didn't do the health screening form. Know that the form and the release statements are not legally binding. It just shows proof that you tried to do the right thing by giving the client the opportunity to not lie, tell you the truth, and when you explain to the client, you say, no, I can't wax, you explain why, and tell them that if I put the wax on, your skin will be thin from the drug, and what happens is you'll get skinned and you'll get a permanent scar, and you can risk permanent hair loss. That's usually more than enough. Don't argue with the client, explain that no, you're not gonna do the service because of the ethical grounds. If they threaten to sue, that's fine. You can always provide evidence saying right here, they were taking retinol, I didn't wanna do the service because their skin will get thin, and that will hold up in court because you did not proceed with the service that could have caused a detrimental reaction. So take a look at the health screening form. Know that some medications that can cause contraindications are antidepressants, hormones, cortisone, medication for blood pressure or diabetes, topical prescriptions such as Retin A, Renova, hydroquinone. A client using any one of these may not be a candidate for hair removal. And when in doubt, always patch test. So know that many medications can cause changes in the skin that can cause the epidermal skin to lift during treatments. In other words, your epidermis will peel right off with the waxing paper, and it's pretty scary when that happens. You actually skin them. Know that clients with autoimmune diseases such as lupus can have nasty reactions when you wax because it's an inflammatory condition. And they can also react to electrolysis or other hair removal methods. Know that conditions such as rosacea, eczema can have severe inflammation because they can be already inflamed before treatment, or the treatment itself through the trauma can cause a flare-up. So always keep a record, and if the client has a flare-up, write that down, and then always talk with the client saying like, where do we go from here? I don't really feel comfortable waxing you. Are you okay? How bad was the flare-up? Typically, if it's very mild, you can wait for the flare-up to go away and then do it again if the client is okay with it. Know that there is a ton of contraindications. Know that any contraindication is something that can react negatively during the process. You have a release form, and where they'll put their name and say I am or not presently using all these medications. They'll check off. The technician will sign, meaning you'll sign, the client will sign, you'll date it. That way you have a written record. Know that you have a whole bunch of conditions. There's a whole list on here. I'm gonna read just a few of them because it's so many. But if your client has any of these conditions, this is when you want to send them to the dermatologist and get a medical sign off that they are okay to be waxed or get a treatment. So one of them will be client has used isotronin, which is Accutane, in the last 6 months, is taking blood thinning meds, is taking prednisone or steroids, is taking drugs for autoimmune disease such as lupus, has a sunburn. If someone has a sunburn, you don't want to wax them because the skin is already burned, and if you do that, it's going to hurt like crazy. If they had any cosmetic or reconstructive surgery within 3 months, because that's a trauma to the skin, and if you wax, you can cause more scar tissue. Has severe varicose leg veins, you can rupture a vein, and that's very painful. Has any other questionable medical condition. If they had any laser treatment, that area is going to be inflamed, you don't want to re-inflame it. If they've done any body peeling where you're doing a body exfoliant, that's also a contraindication that's not written on here. Know that facial waxing should not be performed on clients with any of the following conditions without first obtaining written permission from a physician. Severe rosacea or sensitive skin. A history of fever, blisters, or cold sores. Waxing can cause a flare-up of cold sores, as can other chemical exfoliants, just so you know. If the client had a recent chemical peel using glycolic alpha hydroxy acids, BHA acids like salicylic acids, TCA, or any other acid-based product. If they had microdermabrasion. If they used Azilex, Differenge, Renova, Terazoac, and Retin-A, or any other medical peeling agent. If they recently had laser skin treatment or a surgical peel. And if they're using hydroquinone for skin lightening. So, those are all the contraindications. There's always more to it. Now we're going to talk about permanent versus temporary hair removal, and there is a huge difference. Permanent hair removal, like the name suggests, is typically permanent, and you know, it's not like a one session and you're good for life. You might need some booster sessions to get the full result. Typically, the way that we do permanent hair removal when we're doing laser treatment and photoepilation is the darker the hair, the better the result, because dark attracts heat, and that's typically how lasers and photoepilation works. If the hair is very fine and it's no pigmented or very, very light, it might have less of a success. So know that permanent hair removal services are typically not offered in the salon because we need extra training. Every state is going to vary on what they allow with lasers, photoepilation. I know in Jersey that lasers are not allowed. Some say you can get extra training. I don't know how true that is. I don't do laser hair removal, but it's something I'd be interested in. The most old school and antique way of permanent hair removal is electrolysis. This is typically not done as much, but just know about it to be familiar for your test. Electrolysis is the removal of hair by means of an electrical current that destroys the growth cells of hair. The current is applied with a very fine-shaped needle electrode that is inserted into each hair follicle. This technique must only be performed by a licensed electrologist. So an electrologist is someone who is trained in electrolysis. A dermatologist can also do this. Know that it's not that common, because now we have photoepilation, which is a huge one, and laser hair removal is also another big one. People can also buy their own laser machines online, but just be careful because you never know the damage you can cause. If you feel like you've done enough research, then go ahead and try it. The electrolysis, on the other hand, is also very painful. It's also very time consuming, and the success rate is, it could be more successful. Photoepilation is also known as intense pulse light, IPL. It uses an intense light to destroy the growth cells of hair follicles. This treatment has minimal side effects, requires no needles, and thus minimizes the risk of infections. Clinical studies have shown that photoepilation can provide up to 50 to 60% clearance of hair in 12 weeks. The method can be administered in some salons by cosmetologists and estheticians depending on the state law. Manufacturers of photoepilation equipment usually require special training. So how the photoepilation works is you'll slide this device on, it will shoot an intense light beam on the hair, and it's going to go down there and destroy the hair cells. So over time, the longer you use this and the more you use this, the more permanent the result. An issue with photoepilation and any laser treatment too, we'll talk about lasers next, is that if your client has body tattoos, it's going to be a huge issue because you can actually destroy or hurt the tattoo. So that's another contraindication that is not stated in the book, but that's also from my professional experience of what you need to know. And photoepilation, you're going to have to do more than one session typically to do that. I know if you guys ever watched The Housewives of New York, Cindy Barshop had the bare laser treatment. That's an example of services that use laser and photoepilation. So on to laser hair removal. Laser hair removal is another method of rapid hair removal, and laser hair removal is when a laser beam is pulsed on the skin, impairing the hair growth. It is most effective when used on follicles that are in the growth or anagen phase. The laser method was discovered by accident. It was a happy mistake that turned out good, and it was discovered that when Birthmarks are treated with certain types of lasers. No hair grew in that area because the laser was actually destroying the hair follicle. Know that lasers are not for everyone. An absolute requirement is that one's hair must be darker than the surrounding skin. Coarse dark hair responds best to laser treatment. For some clients, this method provides permanent hair removal. For others, laser hair removal treatments only slow down regrowth. In certain states, cosmetologists or estheticians are allowed to perform laser hair removal under a doctor's supervision. So if you're a medical esthetician or a medical cosmetologist and you're working under a dermatologist or a plastic surgeon, that is one avenue you can take. It typically requires special training and is most offered by laser equipment manufacturers, so they'll have their own brand, like their own machine, and you have to take the class with them. They'll have to certify you, and then you're able to do that in your office under a certification of a doctor. Laws regarding photoepilation and hair removal vary by state, so always check your state board, and when in doubt, ask other professionals on support groups that can give you a direct answer, because sometimes the state's answer is a little like, you don't get a straight answer, yes or no. Other people will know if they have studied this. So the next type of hair removal we're going to talk about is going to be temporary hair removal. And what I'll do is I'm going to be really, really nice to y'all, and I'm going to let you take a early break, digest the permanent hair removal, do your own research with that, and we're going to come back and we're going to talk about temporary hair removal treatments.